Hi, I'm Dr. Laura Perry, chiropractor and co-founder of the Institute of Trigger Point Therapy. I would like to introduce you to a most fascinating field of study, clinical trigger point therapy. Born from the exhaustive work of Dr. Janet Travell and Dr. David Simons, this remarkable clinical approach to physical pain captured my attention more than a decade ago. The study and development of this new clinical system revived my professional career and delivered to my life the meaning and purpose that I had so desperately sought when I entered the healthcare field so long ago. The ability to find a solution to a pain that has plagued a person for years is a powerful affirmation of what life is all about. But I don't want to mislead anyone here. The practice of trigger point therapy can be difficult at times, and it's certainly not going to make you rich. But if you are the type of person that finds value in helping others, then I am very confident that you will find your experience as a trigger point therapist very enriching indeed. The core responsibility of a trigger point therapist is to serve as a translator or interpreter between the client and their physical pain. Pain is first and foremost a method of communication, a fact that is easily overlooked by someone whose life has been disrupted by unrelenting physical pain. The key to understanding pain is determining what specific purpose the pain is trying to serve. All physical pain serves to protect an injured tissue, but the mechanism by which this is achieved varies depending on the type of tissue that is injured. The pain associated with a simple cut on the foot alerts the person to the presence and location of the injury. But the pain associated with an injury to the neuromuscular system, such as a trigger point, is less likely to identify the location of an injury and more likely to proactively modify a person's movement in an attempt to protect the injured tissue. Thus, locating the source of neuromuscular pain is not as straightforward as it is with other types of injuries. It requires the therapist to be fluent in the specific language of neuromuscular pain and dysfunction. Clinical trigger point therapy is a crash course in this often misunderstood means of communication. In the late 1950s, Dr. Janet Travell, MD, serving in a pulmonary and cardiology hospital, became intrigued by the similarity of pain complaints that she observed in patients throughout the hospital. She was surprised to find that even though a patient might be suffering from a life-threatening illness, what they routinely complained about was simple back, shoulder, or neck pain. She was frustrated that none of these patients had objective evidence of a disease or disorder that accounted for their pain complaint. While performing physical examinations, Dr. Travell found that nearly all of the patients had isolated tender spots in their skeletal muscles that, when pressed on, triggered the patient's pain complaints. Dr. Travell began a lifelong study of these tender spots, which she termed trigger points, and her research gave birth to trigger point therapy as we know it today. Dr. Travell was joined in her research by Dr. David Simons, MD, who was a U.S. Air Force flight surgeon when he met Dr. Travell at a lecture she gave in San Antonio in the 1970s. The two often met in Houston, where Dr. Simons was chief of Physiometrics Research Laboratory at the Houston VA Hospital, and discussed the nature of trigger points. They officially teamed up in 1974 and began several decades of exhaustive medical research in the field of myofascial pain. The two researchers went on to publish the definitive medical textbooks in this field of study: Myofascial Pain and Dysfunctions, the Trigger Point Manual, Volumes 1 and 2. After contributing a lifetime of work and research in myofascial pain, Dr. Travell passed away in 1997 at the age of 95. Dr. Simons went on to publish a second edition of their textbook and just recently passed away in 2010 at the age of 87.